The deadly infections in nursing homes. The hidden risk. In today's world, nursing homes and senior care facilities are becoming more important than ever. But behind the walls of these care centers, there's a growing risk that many people don't realize. From silent infections to hidden health threats, many seniors are facing dangers that could easily be preventative. Only more people knew the truth. In this video, we're going to uncover the most dangerous risks hiding in nursing homes, the shocking reasons behind deadly outbreaks, and most importantly, what families can do to protect their loved ones. These are not just headlines, these are real threats, with real consequences. Stay with me, because by the end of this video, you will know how to protect your loved ones before it's too late. The hidden danger in nursing homes. When we think about nursing homes, we often imagine peaceful places where seniors can live out their days in safety, surrounded by trained professionals who genuinely care. Sadly, the reality is not always so simple. Beneath the surface of these facilities, there are hidden dangers that most families are never told about. Every year, countless nursing homes are found guilty of basic care failures, things like poor hygiene practices, lack of proper medical monitoring, and unsafe living conditions. These dangers are especially serious because elderly residents are more fragile than the general population. Their immune systems are weaker, their skin is thinner and more prone to injuries, and they often rely completely on the facility's staff for daily tasks, like bathing, dressing, and eating. When something goes wrong in a nursing home, it often stays hidden until it's too late. Simple cuts can go unnoticed and become infected. Fevers and illnesses can be ignored, leading to life-threatening conditions. In some cases, overworked staff simply do not have the time or resources to notice early warning signs of health problems. The hidden danger in nursing homes isn't just about accidents, it's about a lack of oversight, stretched resources, and an environment where small problems quickly snowball into deadly threats. Families must be alert, informed, and involved, because without constant attention, these hidden dangers can take away precious years from our loved ones. Choosing the right nursing home is not just a decision, it's a responsibility to uncover these hidden risks before tragedy happens. The deadly bacterial outbreak. One of the most serious threats inside nursing homes is the frightening rise of deadly bacteria outbreaks. You may have heard news stories about these outbreaks happening in hospitals, but many people don't realize that nursing homes are often the perfect breeding ground for these dangerous infections. Bacteria like MRSA, coli, and even flesh-eating bacteria can thrive in these environments. Why? Because nursing home residents often live in close quarters, share common spaces, and receive care from rotating staff who may not always follow proper hygiene protocols. Unlike younger people, seniors have weaker immune systems and are more likely to develop severe complications. Even a minor infection can quickly become life-threatening. Worse still, many of these bacteria are resistant to standard antibiotics, meaning traditional treatments don't work. This allows infections to spread rapidly throughout a facility before anyone realizes what's happening. The impact of these outbreaks can be devastating. Residents can go from healthy to critically ill in a matter of days. Entire nursing home wings have been shut down during outbreak emergencies. Families are often left in shock, wondering how their loved ones were exposed to something so deadly in a place that promised care and safety. The rise of deadly bacteria outbreaks shows us that no nursing home can afford to be complacent. Families must ask the tough questions about infection control. Are staff regularly trained on hygiene protocols? How often are surfaces sanitized? How quickly are infections reported and treated? Knowing these answers could be the difference between life and death for your loved one. The shocking nursing home truth. Many families are unaware of just how shocking the truth about nursing homes can be until they experience it firsthand. While nursing homes advertise themselves as safe havens with caring staff and wonderful amenities, reality often paints a very different picture. Behind the polished brochures and friendly tours, the truth can be heartbreaking. Many nursing homes suffer from severe staffing shortages. Caregivers are often stretched thin, forced to look after too many residents at once, and as a result, important details are missed. Medications get skipped. Basic hygiene is neglected. Residents are left waiting long periods for assistance. Even worse, investigative reports have uncovered widespread neglect and even abuse in some facilities. Shocking stories have emerged of residents suffering from untreated dehydration and preventable infections, all because they were not receiving the attention they needed. The most disturbing part is that these issues are not limited to one or two poorly run facilities. Across many regions, government inspections have revealed hundreds of nursing homes with serious health and safety violations. The system that's supposed to protect our seniors is, in many cases, failing them. For families, this truth is painful to accept, but it is absolutely crucial to understand. By knowing the risks, you can take action. Visit facilities multiple times, speak to current residents, check health inspection records, and most importantly, stay involved after your loved one moves in. Regular visits, questions, and oversight from family members are some of the most powerful tools to prevent your loved one from becoming another sad statistic in the shocking nursing home crisis. The silent killer in senior care? One of the most terrifying realities about senior care is the presence of silent killers' dangers that cause harm without immediate warning signs. Unlike dramatic accidents, these killers work slowly and quietly, making them even more dangerous. Silent killers in senior care include untreated infections, unnoticed dehydration, malnutrition, and even the emotional toll of isolation. Elderly residents often have difficulty expressing pain or discomfort. Many have conditions like dementia or Alzheimer's, making it harder for them to alert caregivers when something is wrong. Sadly, this means that conditions like urinary tract infections or pneumonia can progress silently, with symptoms like confusion or tiredness often mistaken for normal aging. The result? By the time symptoms are recognized, it's often too late. The body of a senior is less resilient, and what would be a simple illness in a younger person can become fatal in an elderly resident. Families must understand this risk. Frequent communication with nursing home staff, asking about sudden behavior changes, and watching for any signs of withdrawal or lethargy can help catch these silent killers before they claim another life. Remember, when it comes to senior care, silence is often a dangerous warning sign in disguise. Why seniors are at risk? Why are seniors so vulnerable inside care facilities? The answer goes far beyond age. Seniors face a perfect storm of risks that multiply once they move into nursing homes. Their immune systems are naturally weaker, making it harder to fight off infections. Many seniors take multiple medications, which can cause side effects or dangerous drug interactions that go unnoticed. On top of this, reduced mobility means they are at greater risk of falls, pressure sores, and blood clots. Chronic conditions like diabetes, heart disease, or lung problems make every infection and injury more dangerous. Now, add the environmental factors of a nursing home, close living quarters, shared caregivers, and sometimes overworked staff. Even a single mistake, like forgetting to reposition a bedbound resident or skipping a hygiene step, can lead to a dangerous outcome. It's crucial for families to understand these risks are not just random accidents. They are predictable and, in many cases, preventable. Seniors are at risk because their care requires consistent, high-quality attention, and without it, small problems quickly spiral into emergencies. By knowing these risks, families can be more proactive and fight for the care their loved ones truly need. The nursing home infection nightmare for many families. The greatest fear when placing a loved one in a nursing home is the threat of an infection nightmare, and sadly, it's a fear based in reality. Infections are the leading cause of hospitalization and death among nursing home residents. This includes respiratory infections like pneumonia, gastrointestinal infections like and skin infections that can start from something as simple as a small scratch. What makes this a nightmare is how fast infections spread in a nursing home setting. Shared bathrooms, communal dining areas, and constant close contact with staff create endless opportunities for germs to travel from one person to another. When one resident falls sick, others quickly follow, especially if hygiene protocols break down. Staff often juggle dozens of patients, making it impossible to provide the level of sanitation that's necessary to keep outbreaks contained. Families experience this nightmare firsthand, visiting a loved one in good health, only to receive a phone call days later about a serious, life-threatening infection. The infection nightmare becomes even worse when outbreaks are caused by antibiotic-resistant bacteria, making treatment difficult or sometimes ineffective. The best defense is prevention. Families must inquire about infection control plans, demand transparency about outbreak history, and be ready to escalate concerns when warning signs appear. Infection nightmares can happen fast, but awareness and vigilance can keep your loved one safe. The deadly infections you didn't expect. Most families expect nursing homes to be a place of care and recovery, but the reality is that many deadly infections appear in ways people never expect. It's not always dramatic illnesses like pneumonia or sepsis. Sometimes it starts with something small: an unnoticed cut, an untreated sore, or a minor cold. In nursing homes, these minor issues can spiral into life-threatening infections. One example is urinary tract infections, which can cause sudden confusion in seniors and even lead to hospitalization if untreated. Another is Clostridium difficile, a dangerous intestinal infection linked to antibiotic overuse, which can quickly sweep through entire facilities. Even conditions like influenza, which younger people usually recover from, can become fatal for older adults. These unexpected killers don't come with big warning signs. They sneak in quietly, taking advantage of weak immune systems, medication side effects, and a slower response from overworked staff. This is why families must remain watchful not just for obvious symptoms, but also for sudden mood changes, loss of appetite, or confusion. Deadly infections often hide behind small signs, and recognizing them early is key to saving lives. The seniors face this hidden threat when seniors move into nursing homes. Families breathe a sigh of relief, thinking their loved one will finally be safe. But one of the biggest threats facing seniors isn't something you can see with your eyes. It's the hidden threat of neglect. Neglect happens when residents don't get the care they need, when their needs are ignored, or when they are left unattended for too long. This hidden threat builds over time, creating dangerous consequences: malnutrition, untreated infections, dehydration, and rapid mental decline. Many seniors are too afraid or too confused to report neglect. They may suffer in silence, becoming weaker each day without anyone noticing. Staff shortages, high turnover, and poor training all contribute to this growing problem. The hidden threat of neglect is responsible for thousands of avoidable hospitalizations every year. Families must learn how to spot red flags: sudden weight loss, unwashed appearance, bed sores, or emotional withdrawal. Staying involved, visiting often, and asking direct questions can expose this threat before it's too late. Don't be fooled by clean lobbies and pretty brochures. True care shows in daily attention, compassion, and consistency. The urgent warning for elderly care. There's an urgent warning being sounded across the country. Elderly care facilities are under pressure, and it's putting lives at risk. With a growing senior population, many care centers are struggling to keep up, leading to dangerous compromises in care. Nursing homes are facing chronic staff shortages, caregivers are often overworked, facilities are overcrowded, and the quality of care is declining. This urgent warning isn't just about staffing, it's about the entire system failing to protect the most vulnerable members of society. Families who ignore this warning risk seeing their loved ones suffer. More seniors are being hospitalized with preventable conditions, more outbreaks are happening, and more reports of neglect are surfacing. This warning is simple but critical. Families must do their own research, advocate strongly for their loved ones, and demand accountability from care facilities. Ask about staff ratios, ask how emergencies are handled, be involved, and don't wait until tragedy happens to speak up. When it comes to elderly care, waiting costs lives. The infection crisis no one talks about. There is a silent crisis happening inside nursing homes, and most people never hear about it. The infection crisis. Despite all the medical advancements of modern times, infections remain the #1 cause of hospitalization and death in elderly care facilities. The sad truth is that this crisis is hidden from public view. Families are told their loved ones are in safe hands, but behind the scenes, basic infection control is often overlooked. Gloves are skipped, cleaning protocols are rushed. Sick residents are not isolated fast enough. Government reports have shown that thousands of nursing homes are cited every year for infection control failures. Yet many continue to operate without significant changes. The infection crisis happens because the elderly are more vulnerable, and because many facilities are underregulated and poorly monitored. This is the infection crisis no one talks about, but every family must know. By understanding this hidden danger, you can push for safer practices, ask the right questions, and fight for the dignity and health your loved one deserves. Awareness can turn this silent crisis into a loud demand for change. As you've seen throughout this video, the risks inside nursing homes are very real. From hidden dangers to deadly infections, from silent killers to shocking truths, every family deserves to know what's happening behind closed doors. The goal of this video is not to scare you, but to prepare you. Because knowledge is power, and awareness can save lives. If you have a loved one in a nursing home or you're planning for senior care, I encourage you to be proactive. Visit often, ask questions, speak up, and never settle for anything less than proper care and respect. Together, we can hold nursing homes accountable, and create safer environments for our elderly family members. Thank you so much for watching this video. Your time, your care, and your attention can make a world of difference. If you found this video helpful, please consider sharing it with others who might need it. Take care of yourself and your loved ones, and I'll see you in the next video.